Hello family, hope y'all doing okay today. I had to share some news with y'all. I went to my surgeon this morning to discuss my total knee replacement for next month, and he had an x-ray done, and he had me walk around the office, and he talked to me, and he said, you should not go through with this knee replacement at this time. He said, you don't need it. I told him that I've been losing weight, and he said that he thinks that has helped me tremendously. And I told him I have more weight to lose, and he said the more you lose, the better off it's going to be on your joints and your body. And he said right now the risks of the surgery would so outweigh me needing the surgery. And I said, well, how long can I go without it? And he said, years and years, probably. He said he would only do it if I get to the point to where I'm almost incapacitated, that I can barely walk it off for the pain. But he said, you're walking good. He said, you do have bone on bone in the knee, but he said, overall, you're doing pretty good. And he did go ahead and give me another knee injection today. My insurance will pay for one every 3 months. And how many doctors would be that honest with you? You know? How many would tell you, no, you don't need to have this surgery done? And Eric and I thanked him so much for his honesty and just being honest with us about me not needing the surgery. Because I'm sure there's doctors that would have said, yes, you need it. Maybe for the money, I'm not sure. But this is one classy doctor. He is wonderful. I kind of felt sick to my stomach during the knee injection, which I always do. And he went out himself and got me a glass of water and brought it back to me. I mean, he's a genuine, caring doctor who looks out for the best interest of his patients. And that means a lot. It really does. But I am thrilled. Feel like a mountain's been lifted off of me. Eric's thrilled. And we're just like on cloud 9 right now. I was worried about the recovery period and trying to recover from it. And I know that there's risk of blood clots, infections. There's a lot of different risk. And he said it is not worth putting me through that when I don't need the surgery. So I'm just gonna live life, y'all. Just live my best life. That's all any of us can do. Just try to live your best life. Hope y'all have a blessed day. Remember, it's gonna be okay. It really is. Try to be kind, and I love y'all.